I'm Dr. Michelle Pennie, founder of Bliss Dermatology and Wellness. If you've been scheduled for Mohs surgery, you may have some questions about what to expect. So today I want to talk through the process, from how to prepare to what the day looks like and how to take care of yourself afterwards. So first, let's talk about what is Mohs surgery. So Mohs Micrographic Surgery is considered the gold standard for treating basal cell and squamous cell carcinomas with the cure rates of reaching almost 99%. The goal is simple: remove the cancer completely while preserving as much as healthy tissue as possible. I perform the procedure right here in the office, and we have our on-site Mohs lab, which allows us to process and examine the tissue the same day. So what should you expect before your procedure? Plan to set aside most of the day. Usually the surgery procedure itself will take several hours, but we'll want you to go home and rest afterwards. Because we examine each layer of tissue before deciding whether additional tissue is removed, the process is done in stages. Like I said, most patients are here for several hours, so bring something to read, a snack, a friend or family member to stay with you. You'll be awake throughout the procedure. We just use a local anesthesia to make you completely comfortable. But having some company and distraction makes the wait much easier. On the day of your surgery, come with clean skin on the treatment area. You can have a normal meal, take your medication, unless we told you otherwise. If you're on blood thinners or medications that might affect your healing, we certainly will have discussed that with you in advance. So now let's talk about what happens during the procedure. The process begins with me mapping and marking out the tumor. I then remove all the cancerous tissue along with a thin margin around it. The tissue goes to our on-site lab where it's processed, it's frozen and sectioned so that I'm able to look under the microscope and examine all of the tissue and all of the margin to make sure we have everything that's cancer-free. Once all the cancer is removed, we do the repair, the closure for the wound. Depending on the size or location, this may be straightforward with a simple linear closure. Other times things are more complex, so I may use flaps or graft to be able to help that area heal up as quickly as possible, and always to have a great aesthetic outcome. So now let's talk about recovery. This is where you play a very important role. After surgery, we'll send you home with some detailed post-operative instructions. These are some of the key things to keep in mind. We really want you to avoid strenuous activity for about a week. This means no heavy lifting, vigorous exercise, or anything that could put stress on the surgical site and increase risk of bleeding or opening up the wound. We would like you to avoid alcohol for at least 2 days, and please no smoking during your recovery. Both of these can impair healing and increase your risk for bleeding and infection. So we also ask you to keep a close eye on how things are progressing. It's normal to have some swelling, some bruising, and maybe have some mild discomfort for the first couple of days. But what is not normal is bleeding that doesn't stop, any signs of infection like redness, warmth, or any discharge from the wound. So if you have any concerning symptoms, please call us immediately. Our team is here to help you out throughout the healing process. We're available to answer questions and support your recovery in every step of the way. When you leave our office, we aim for you to leave with confidence, knowing the cancer has been fully removed and healthy tissue is preserved, and you have everything you need to heal well. If you have any questions about Mohs surgery or would like to schedule a consultation, visit us online or give us the office a call. We're here to help.